Good. Welcome to the Half Hour to Help tonight. And first off, thank you so much for braving that giant full moon out there. I know how scary that can be. We're going to talk about blood pressure. Okay, now what's tough is this is one of the most ignorant therapies I've ever seen on the planet. And we're going to start to break through a lot of barriers. And it has to do with not just legend, but with false medical practices. So when we look at this, let's figure out how we actually take blood pressure. Now this is going to sound really crazy because how we take blood pressure is over 100 years old. It was found out in 1905. So what they do, and I'm going to walk you through this, so if this sounds antiquated and stupid and ridiculous, okay, they're going to put a blood pressure cuff on you and they're going to increase the pressure on this until they actually shut the blood supply off to the arm. And then they're going to put a listening device a little bit further down the arm than the blood pressure cuff. Then they're going to slowly release the pressure on this until they start to hear a sound. And then they write down that pressure. Okay, and then they keep releasing the pressure until they hear, oh, it has stopped. And then you write it down. Now, this is considered how we take blood pressure. And I know it sounds antiquated. It is over 100-year-old technology. So, but what it does, the theory is that the first number is the output of the heart. Okay, the second number is the overall resting pressure of the body. But now let's see if that's really appropriate. Harrison's medical textbook. Now this was back in the 70s and 80s, before there was a massive drug influx of the patients. One of the most brilliant ideas, and I usually don't hear me say common sense in medical textbook, but the first principle of hypertension or high blood pressure is to know when to lower it and when not to. Oh my gosh, that makes sense. So does that mean everybody should have the same blood pressure? Well, let's look into that. First off, does high blood pressure give you a headache? No, it doesn't. See, what happens is I get patients in here that say, wow, I had this headache, so I knew my blood pressure was high. And sure enough, this headache was killing me. And so I took my blood pressure was high. Okay, now, anybody in here with common sense? Come on, raise your hand. Okay, do you think the pain caused the blood pressure to elevate? Yes or yes? Okay, good. Yeah, because when you look at this guy over here on the left, I mean, he's weightlifting. Under that strain, your face turns red and everything else. If high blood pressure caused headaches, they'd have warning labels on exercise equipment. Back away from that stair stepper. It's going to raise your blood pressure. What are you doing? Put down that weight. Don't go for a run. That's stupid. Okay, so you got to look at this. Blood pressure varies depending on the need, on the load, on what you're doing. If the blood's thicker, like as in diabetes, we're going to see blood pressure of like 160 over 100. If you have heart disease, why would blood pressure be higher if you have heart disease? So first off, you got a heart. You got blood vessels that attach to it, that supply it. And if you have disease, that means some of those tissue, there may be some scar tissue, there may be some damaged arteries. So blood pressure has to actually increase. So it's absolutely insane to compare all of these different problems with a normal blood pressure. Plus, if you have a normal artery, okay, and let's say you go through, fast food, you have a couple of medications, some toxic exposure, you're over 40, or that artery that's supposed to be big and full gets a little bit smaller. What do you think has to happen to blood pressure in order to keep the oxygen flowing? Pressure has to increase. Absolutely, absolutely. Now, one of the things that doctors, and I know a lot of doctors are watching these videos, is they have to start thinking, what's the function of blood? And so when you the function of blood, you could. Okay, so what does it do? It carries nutrients. It eliminates waste products. It regulates pH. It carries vital immune system functions. So, these are actually very vital functions. Now, what function of blood, carrying nutrients, eliminating waste products, regulating pH, helping the immune system, which one, if you slowed down, would your health be improved? Answer? None. You need actual healthy blood function. You do. And this is typical of a patient. Okay. I've used Dave before, but he comes in with high blood pressure, and they're given a ton of medications. Now, the one question, the quality of your life depends on the quality of questions you're going to ask. If you're diagnosed with high blood pressure and say you're over 30, really, doc, my blood pressure's worked for a third of a century. In my case, it's worked for over half a century. Why is it not working? Why is my blood pressure not regulating? What are your gauges? What are you measuring? Okay, does that make more sense? So ask questions, because honest to goodness, the quality of your life directly depends on the quality of questions you ask. If you ask the wrong question, or you just accept this belief system that everybody's supposed to have the same blood pressure, you're going to die early. At least that's what the science says. So when we look at this, we actually went in and said, gee, why do you have joint pain? Do you think the joint pain might have contributed to the high blood pressure? Well, possibly. So let's fix that. Do you think that maybe the high blood pressure might have contributed to the elevations in blood sugar, and maybe the antacids that you were taking contributed to the lung issues? You know, we're more detectives. Okay, we look for the why instead of just drugging the symptom. And yes, this is the cart before the horse. I just like that. Okay, when you look at this, does high blood pressure cause headaches? No, absolutely not. Does pain elevate blood pressure? Absolutely. So when we look at this, does strokes, is that caused by high blood pressure? No, the exact opposite. When you look at this, what happens is you have damaged arteries, okay, and this comes from smoking, fast food, poor lifestyles, or medications, okay, or the arteries get smaller, so that actually is going to increase the blood pressure in order to maintain integrity, maintain oxygen to the kidney, maintain oxygen to the brain. And so when you look at this, these people who have damaged arteries, what are they going to consistently read when they go to the medical doctor? They're going to consistently say, hey, look, your blood pressure is high, you're at risk of stroke. No, that's the cart before the horse. That's stupid. Hey, your blood pressure is high, by gosh, it's adapting to toxic deficient circumstances. We got to clean those arteries. Makes sense, doesn't it? I know, I just saw a light bulb go over your head. Oh, wow. Okay, good. Kidney disease. You got these little kidneys that filter the body's blood. Okay, if you've had bad arteries, guess what has to happen to blood pressure? Has to increase in order to keep it flowing through the filter. So if you look at the kidney as a problem, no. The kidney is damaged, so the body's adapting to elevate blood pressure. It's absolute foolishness to look at it any other way. Yes, there is a heart attack grill. Okay, I mean, when you look at this, and it's kind of interesting. There's one in Arizona, there's one in Vegas. This is called a quadruple bypass, and they do have French fries deep fried in lard. Okay, actually, lard is healthier than some of the other oils, but when you look at this, I know that's an attractive burger, but if you eat this, okay, and this is regular part of your diet, there's endotoxins on there. The endotoxins, along with some genetically modified gluten products. I mean, this is actually a poisonous product. If you're going to eat it once a year, it's not going to harm you. If you eat it, on a daily basis, it will kill you. So I like the truth in advertising. Heart attack grill. It should be. Now, what you may not be aware of is non-steroidal anti-inflammatories. Okay, Advil, Tylenol, or Advil, Motrin, Aleve. Okay, Tylenol is not a non-steroidal, but it has the same type of effect. Did you know that out of the archives of internal medicine, you have a 10-fold increase of congestive heart failure if you take these? Did you know that? So, remember, the quality of your life depends on the quality of questions. We're talking about blood pressure tonight. If we know that pain is going to increase, it's going to increase blood pressure, what do doctors give you to reduce the pain? Typically a non-steroidal anti-inflammatory. I mean, that's not only unethical and unscientific, but it's also insane. Because it destroys proteoglycans, that's the building block of cartilage, but it also increases the risk of heart failure? Hi, I know you're in pain. Take this ibuprofen. Yes, it's going to destroy your joint cartilage, and it's going to increase your risk of heart disease. And they say the health food store guy is nuts. No, this is nuts. And then another one out of the archives of internal medicine. And when you see a study that involves 80,000 women, would you pay attention to it? Yeah. Okay, 80,000 women, if they take 22 non-steroidal anti-inflammatories a month, So what is that? That's like one a little bit more in every other day. Not the one every 4 hours. Okay? This is the one every other day just about. Okay? 86% increase, okay, of high blood pressure. So how many people, I mean, do you see the high blood pressure warnings on Tylenol? No. Do you see it on the ibuprofen or the Aleve or the Motrin? No. So we have to start looking at the quality of your life depends on the quality of questions. We're not going to drug human beings anymore. Aspirin. This is one of the most dangerous drugs out there. See, aspirin is the leading cause of kidney disease. So if you're taking an aspirin a day for a healthy heart, even though it says that it doesn't help with cardiovascular risk, I mean, this is why they prescribe this deadly drug. Aspirin's the leading cause of kidney disease, the 4th deadliest drug in America. And what do they prescribe it for? To prevent heart attack? Really? Really? Well, this one says right here, Journal of the American Medical Association and the American Heart Journal, it says it doesn't prevent cardiovascular disease. So what's the other reason? To thin blood? Really? Thin blood. Okay. Wouldn't water thin it without damaging the kidneys? So I guess water might be a better choice.
Vitamin K too.
And there's a lot of pluses that we could do to actually make the body healthier instead of giving something toxic to the kidneys. Now let's just say aspirin, since it's the leading cause of kidney disease, do you think that might damage the kidneys? Yes or yes? If you damage the kidneys, what's the body going to have to do to blood pressure in order to keep blood flowing to that kidney? It's going to have to raise it. Wow, gee, I can connect the dots. Okay, now we've got something that's more important. There's a radical shift in thinking in science, and it's going to take around 30 years for the medical doctors to catch up, because it takes about a generation for ideas to change. We used to think that germs cause disease, and now we know that it has to do with the weakness of the immune system. We used to think that genes are like the defining moment. You know, if you have this type of gene, you're going to develop that type of problem. However, now we know that there's an epigenetic control. I mean, Bruce Lipton first wrote the few books on it about 8-10 years ago. But this means there's a control above the genes. See, if your sister or mother or brother had cancer, and that's not genetic, you can choose to express that gene or not express it. So there's a gene expression, or there's an epigenetic or control above the genes. This is a frightening article, because this is out of the Metabolism Clinical and Experimental Journal. This causes epigenetic control. This means it can control gene expression. And I want you to take this part home, because if your genes are expressed to produce cancer, you're going to make cancer. If your genes are chosen to express protection, you're not going to develop cancer. So this is the difference between cancer and not cancer. This is the difference between heart disease and not heart disease. And these things can change that. And we're looking at cholesterol-lowering drugs, cause epigenetic control, blood pressure drugs, diuretics, okay, but other blood pressure drugs, pain relievers. All of these medications cause epigenetic control. Now that changes. What that means, and there's never been anything worded more clearly in most medical journals, because I read medical journals all the time. Okay, the pharmaceuticals may be involved in the etiology, there's the source of heart disease, cancer, mental disorders, obesity, schizophrenia, leukemia, sexual dysfunction. This is the core of it. Consequences for modern medicine are profound. Since it would imply that our current understanding of pharmacology is an oversimplification. No, say it with me. Wow! This is insane. That means that every doctor out there is prescribing medications that can control your genes and change your genes and make you die early. Now, I was doing an event Saturday at this gallery, and it was really neat. I mean, I'm used to lecturing in front of people, but this was more like a dialogue, where I was there and just people were coming up and asking me questions. And I said, yeah, you know, it's these medications, they're not good for you. They weaken your body's immune system. Because I was specifically talking about blood pressure. And this person came up, a little caustic. I mean, they'd taken the red pill. They are now in the matrix. They felt that the blood pressure drug was like actually really beneficial. And they said, well, look, my doctor took anatomy and physiology just like you did. And I said, well, that's not exactly true. I said, they're taught pharmaceutical approaches where you control symptoms with drugs. No, that's not true. And I said, well, they're working on different information. See, they're taught that lowering blood pressure is actually beneficial with a chemical. You see, in order to have a drug, it has to be a patentable chemical. This means it's a chemical that's never been seen on the planet. That's actually unique. In fact, it's never been put in your body before. So every drug out there, we used to call it patent medicine. It's a chemical completely unique to the body, completely unique to the planet. That way they can get a patent on it and put it in you. Now, the companies that make these completely unique chemicals that's never been made in nature, that's never been put in a human body, actually, in order to get those approved to be this chemical put in human bodies, am I driving the point home yet? That it's a foreign chemical? Okay, they do the studies. Now, they actually produce as many studies as they want. So let's say they got a chemical to reduce pain. Let's call it, I don't know, Vioxx. That sounds like a pretty name. Okay, so they produce this chemical, and they can make 20 different studies. Okay, now the companies that are making the studies, they can choose the placebos, and since they're working for the company, they're going to make the study turn out good, or as good as they possibly can. Well, if 18 of those studies are bad and show that the drug is deadly, the company only needs to take the 2 studies that show it's good and present those to the FDA. So we have the wolf making the drug, watching the hen house, and, skinning the chickens. So now when Vioxx comes up a few years later, killing more people than the Vietnam War in less time, so it's actually more efficient than war. Wait a second, it was for pain relief. Okay, yeah, so do you see what I mean? So the medical doctors are actually taught that that's beneficial, and it's not. It's absolutely not. I mean, this is a great study, the Helsinki Businessman study, where they actually divided these group of guys into 2 groups. One group got the finest medical care around. That means they got their blood pressure lowered with a patentable chemical, their cholesterol lowered with a patentable chemical. If they had diabetes, that was lowered with a patentable chemical. And the reason I'm kind of putting patentable chemical, because, well, wait a second, I forgot. What's the name of that cabinet next to the bathroom sink?
The medicine cabinet?
It's not a medicine cabinet. No, you can't get one of those from Home Depot. It's called a bathroom cabinet. See the training? I'm excising this out of you. You will no longer say medicine cabinet. You will say bathroom cabinet. Okay, so when we look at this, these guys, the 2 groups. One group got the blood pressure drugs and the cholesterol, and saw the doctor 4 times a year. The other group got nothing. In the treatment group, there was double the death rate from all different types of diseases. Why? Because those patentable chemicals have... But the whole thing was for cardiac deaths. There was 4 times the group died. 4 times the amount of people that got the therapy died. The group that didn't have anything done didn't die. So can you understand why I keep harping on patients? Look, keep checking your blood pressure, keep checking your blood pressure. Talk to the doctor. I mean, the doctor has no information on it. Now when you read these, and the discussion is just brilliant, because remember, the company made these medications. They paid for the company, the lab to study it, and the lab is working for the boss. They want to make sure the study turned out good. This is an 18-year-long study that didn't turn out too good. So they got to backpedal. This is called a CYA. Cover your keister. Okay. The unexpected results, 4 times the amount of death rate. Okay, the Helsinki Business, it seems to give a pessimistic impression. Pessimistic impression. Could you word it any nicer? You can see like Disney with like the bluebirds flying around this. Okay, as a whole, the Helsinki Businessman study results cannot be interpreted as refuting the current idea of cardiovascular risk factors. What is it? Population control? Okay, I mean, that's just insane. And then when you look at this is again, if you have cardiac arrhythmias, okay, they say that when that heart just skips a beat, that the blood clot can go to your head and stroke. How about just fixing the nerve supply? So then you got a choice of taking Coumadin, which causes these side effects, which is a little bit of rat poison, or doing nothing. If you do nothing and you have cardiac arrhythmias, you have a 94% chance of never having a stroke. If you take this toxic drug that has a tremendous amount of side effects, you have a 97% chance of never having a stroke. How about taking vegetable juice and cleaning the arteries? Then you'll have a 100% chance of not having a stroke. This is antiquated, barbaric information. We got to stop this stuff. Higher blood pressure at lower death rates. Remember what we're talking about? And this is involving 48,000 people with heart problems. So if you have heart problems, do you think the pressure has to increase to save that heart? Yes or yes? I know, it just makes sense. So it's insane to think that one blood pressure for everybody. That doesn't make sense. Even in India, they say that if your blood pressure is below 140, and that's kind of like our limit of like what ignorant Americans would call high blood pressure, they say that this is dangerous because it's falling below the minimum necessary for sound health. Yes, quite. I mean, when you look at this, by God, if your blood pressure is going too low, you're not having enough oxygen flow into the kidneys. The kidneys it's the most brilliant organ you've ever had. It's the size of your fist. Heck, it's so cool you got two of them. Okay? In one day it produces 2 quarts of waste products. This means it's filtering the blood. This means anything toxic in the blood are going to be poisonous. 15% of people on dialysis are there because of Tylenol. Okay, or other non-steroidal anti-inflammatories. So do you see a warning on there? Like, don't take the pain reliever. Okay, it's deadly for high blood pressure. It's deadly for the kidneys. No? Yeah, okay, good.
Doesn't Tylenol mess up your liver too?
Well, Tylenol is the deadliest drug in the world for the liver. It is. And it's really a very common way to commit suicide. Yeah, I think a bottle goes a long way. That just about does you in. But all of these things to lower blood pressure. Remember, these journal articles here say heart disease, cancer, diabetes. If you're slowing the pump down, does that help oxygen to the brain or slow it down? All you got to do is look at the side effect of the blood pressure drug. It's dizziness. Why would dizziness be part of the effect of a blood pressure drug? You're slowing oxygen down to the head. The body wants to kick the legs out from underneath to get your head level with the ground, to keep your brain alive. I mean, it's crazy. I want people to increase the blood pressure and then find the problem when it's there and then clean the arteries. Because it's not a blood pressure issue. It's an arterial issue. This one is brilliant. I actually got this, okay, once for fun. It's called a Respirator. It's $350. Okay, so if you just want, you have more money than sense, okay, you go out and get one. Okay, but it's got a sensor around the tummy. Now, let me tell you, you've got a sensor right here in the neck. Okay, it's called a carotid body and carotid sinus. One checks the carbon dioxide levels, the other one checks the pressure levels. So if your carbon dioxide levels are high, you're really acidic. So this heart is going to increase its pressure to get that blood flow into the lungs so you can breathe deeper. If the carbon dioxide level is lower, it's going to slow down the heart rate to get the carbon dioxide levels back up. So the carbon dioxide levels regulate the pH. So this is guaranteed to work when blood pressure drugs aren't effective. And all it does is you listen to a tune and you breathe in, you breathe out, okay, well, it's a little prettier tune than that, okay, but you know, it causes you to deep breathe for 15 minutes. So guess what I tell patients? Okay, you want to lower your blood pressure, it takes you around 2 weeks. Sit down with your arm level, and take a deep breath in for 10 minutes. Then take it. Cold room, full bladder, stress, dehydration, all of these things are going to change your blood pressure. What happens, what people do is say, oh, doc, man, my blood pressure is really high, man. You know, I was really thinking about going back on that drug. Really? How long did you take it? Well, I didn't have 10 minutes. You know, I just had my coffee. I came in from my run. I sat down and I took it. It was way high. Okay. Do you want to take your blood pressure while you're riding a bike? No. Do you want to take it while you're lifting weights? No. Do you want to take it while you're upset watching a sporting event? No. Okay, why? Because it would be too high. Okay, if the whole point is taking it so it's low, because I don't care if it's low or high, that's just an indicator of if the arteries are clean or the arteries are filthy. Okay, so take it, get your body in the same physiologic state. This thing is great. Okay. And you're going to get the same consistent reading. This right here, this gal, I mean, she went in, chest pain, okay, left arm numbness, and indigestion. Now this is all, the American medical system. She went for a full cardiac workup because these are all signs of a possible heart attack. Instead of going to a chiropractor, she went to the medical world. And the medical world is paid by procedure. They're not paid for outcome. So what do? They gave her a chemical stress test, radioactive dye, take a picture of the heart, and then another radioactive dye, and then on top of that, they gave her some chemicals to elevate her heart rate. So she's sitting in a chair, and her hands are shaking, and then they take another scan of the heart, and they say, wow, 2 arteries are clogged. And which is kind of odd because that's not really an accurate way to assess arteries. So what they did is they put in 2 stents, gave her some blood pressure medications. For some reason, they think that chemically slowing down the heart is actually going to be good for her. But what have you learned tonight? That blood pressure might be good for you? Okay. The people that have really low blood pressure, they're dead. They're in the funeral thing over there. Okay, so you want healthy blood pressure? Well, and then all these drugs, 3 weeks goes by, she gets the exact same symptoms. Exact same symptoms. She calls me up on the phone. She's an old patient. I haven't seen her in like a year. And I said, left arm pain, huh? Okay. Put your right ear on your right shoulder. She said, wow, pain went away. And she said, yeah, but this is indigestion. I said, okay, lean off to the side because, if you irritate the diaphragm on the left-hand side, that can mimic indigestion. I said, lean over to the side. She says, wow, the digestion feels better. And I said, yeah, it has to do with nerve impingements. Don't worry about it. We'll come in. Because, so did they make a mistake by putting the stents in this woman? Yes or yes? Absolutely they did. Well, when we look at it, the angiograms, okay, they're accurate 22% of the time. Read that backwards. They're inaccurate 78% of the time. When we look at the inner examiner reliability, okay, so this is the angiogram that they did to find out. The same test read by the same person is read the same a third of the time. Does that sound like modern, absolute, brilliant science, or really kind of like, pick up the dart and throw it at the board? Then you got the stents. I mean, they were supposed to be in angioplasty where they have a balloon. This was supposed to be brilliant, okay, and save bypass surgeries. However, it's not. It's actually getting even worse. And then when you put a stent in, which is a hunk of wire, and it goes in there and expands out, yeah, the artery is alive, but does it cover the entire clog? Does it open the artery? Is there any problem with maybe blood clots in the future? You have a wire thing against cells that are always reproducing. Does anyone see a problem with this? It's like, guys, you can't be serious. I mean, 50 years from now, they're going to go, they did what? I mean, next week we're talking about the polio virus, and I'm going to bring up some therapies that they did in the 30s, 40s, and 50s, where they're injecting arsenic in kids, where they're rubbing mercury on the body. Okay, we're looking back at that as, God, that is so stupid. Okay, we're going to look back at this as, wow, that is so stupid. Okay, but it is. And then you got crazy people like this, like the Icelandic people that had an 80% reduction in coronary heart disease. And they found out the miracle drug was actually changing your diet, smoking less, and exercising. This is a healthy blood sample. That's an unhealthy blood sample. And this is out of the Annals of Internal Medicine. If you eat 1 more serving of fruit a day. So how do we get 100% of the people to reduce their blood pressure medications in 2 weeks? We take care of the nerve supply, and I say go out and get a glass of fresh vegetable juice every day. Go and say it with me. Wow! Is that scientific? Yeah, it's a heck of a lot more scientific than taking a pain reliever. Why? There's the science. Your body needs this stuff. It knows what to do with it. Heck, this is a clogged artery that's a clean artery. Again, fruits and vegetables clean the arteries. If you want, I mean, we have in our lending library the video called Eating. For those of you watching it on YouTube, look at the RAVE diet. You're going to see a doctor in there that had a heart attack, had clogged arteries. Within 90 days, they're clean. And all it takes is fruits and vegetables. Ray, 12 years he was taking blood pressure medications. If you're slowing your heart function down for 12 years, that slows every metabolic process down. 90 days later, he was off his blood pressure medications. He's one of our testimonials. I mean, but we have thousands of people. We have a 100% success rate reducing or eliminating blood pressure drugs within 2 weeks. And all it is getting the nerve supply working and getting off of the stuff that's causing the heart to work too hard. And taking it correctly. Does that make sense? Yes or yes? I know. The body's brilliant. This is what your body requires for a healthy life. Okay? You need to have healthy nerve supply. You need to have regular exercise to detox your system. You need to have healthy nutrition. This means if it comes in a box or a can or a microwave, it's going to damage your arteries. Okay? I mean, that's clear. So you can't have that stuff. You need sufficient rest. This means you got to be asleep at night. And it takes about 21 days to solve the worst insomniac forever. And prayer and meditation, absolutely. This is what's required. Now, we do have a health check, and this is absolutely a call to action. It's a way to get your vitality back. It's to not just eliminate medications, but remember, medications slow your metabolic processes down. So take advantage of this, and I mean it's absolutely vital. Now all of these are recorded. Next week we're going to go over probably the most fun lecture. I do a vaccine lecture 4 times a year, and next week I'm doing it a little different. I'm taking one vaccine and just tearing it apart. Okay, looking for the lack of science and stuff. And next one we're talking about the polio vaccine. Now this is a religious institution. It's not actual science. So we're going to go over the actual facts that polio was not wiped out by vaccines. But now you know the body's self-regulating and self-healing, yes? You don't require a medication to regulate it. You want to respect the body's process, yes? Yes. All right. Health revolution.